I think a story that's not getting enough attention is what's happening with lifestyle medicine. I didn't know much about the Centers for Medicare and Medicaid, but 100 million people basically interact with the healthcare system through this massive agency led by Dr. Oz. $1.5 trillion. So that's right, Dr. Oz, the TV guy, he leads this huge healthcare agency, and he's telling the American Medical Association to make America healthy again. So let's go on a little journey about Mehmet Oz. Dr. Oz, the dude who is leading this stuff, kind of the lesser known face of the Make America Healthy Again movement. I didn't know anything really about Dr. Oz, but he's a really interesting dude. So he grows up as a dual citizen between US and Turkey. He even trained with the Turkish army, which is mandatory for him. And just check out his credentials, okay? This is gonna be important. Undergraduate degree in biology at Harvard, magna cum laude. I mean, just hold on to that fact because that's going to come back later. He played safety on the football team, goalkeeper on the water polo team. Then he gets a medical degree and an MBA from the University of Pennsylvania. He invents this medical device called the mitral clip, which enables people to get basically open heart surgery without the invasiveness. Anyway, this is medical stuff I don't fully understand. And so here's a theme we're gonna see more. Is like, here's this guy who comes out of Harvard, top in his class in biology, a medical degree from University of Pennsylvania, and an MBA, but physicians are dismayed that he is around. And there's all this controversy about Dr. Oz. They say that he was pushing questionable weight loss schemes and other medical guidance. Oh, interesting, so he had different opinions on that, and he talked about the Ebola virus. And basically, these physicians come out and they're super against Dr. Oz. They say he's repeatedly shown disdain for science and evidence-based medicine. Meanwhile, he's got this hit TV show, Dr. Oz. And here is another theme that'll come back, is that he's a huge investor. He holds millions in companies that he would basically oversee. Because, I mean, he's leading this government agency that provides healthcare for 100 million people. A $1.5 trillion budget. I mean, that is a quarter of the United States federal budget. His net worth is estimated to be between $100 and $330 million because he's all up in the new healthcare system, investing in artificial intelligence, medical products. And he told federal employees that they should just eat less this holiday season. He's telling Medicaid recipients to stop eating so much cake. And so just to be clear, this is gonna be important. Medicaid is the healthcare program that taxpayers pay for poor people and for low-income children. Medicare is for seniors. And Dr. Oz is all about next generation healthcare, AI, all this stuff. So he's throwing these events talking about personalized solutions in medicine and basically about taking the whole old healthcare system and changing it. Trump issued this order called the Executive Order on Transparency. It's this one here, Making America Healthy Again by empowering patients with clear and accurate and actionable healthcare pricing information. So basically what this means is that healthcare providers and hospitals have to tell you how much something costs. Kind of wild that that's not already the law. And Dr. Oz wants to shift the narrative from sick care to prevention and wellness, holistic health outcomes. And one of the things I love about this story is like, that is the kind of stuff that if you had talked to a Democrat in like 2012, they would have been like, yes, like 100 million% yes. And I can prove it. So in 2010, UCLA Health in LA conducted the largest national survey of its kind about alternative medicine. You know, holistic stuff. And they found that 77% of participants liked it. But Democrats don't like it when Dr. Oz does it, because here he is in 2021 getting told that he shouldn't be a senator or a doctor. Even though he literally graduated #1 in his class in biology at Harvard and then got a medical degree from one of the best schools in the nation. Because I don't think Dr. Oz is about the old system. He says food is medicine, and like just being personal about it, that pulls at my heartstrings. I love that. He championed the idea that nutritious food should be treated as a reimbursable medical intervention. That's right, he's trying to get health insurance to treat healthy food as part of the program. I don't know exactly what that means, but the Food is Medicine Coalition loves it. They're talking about changing the policies under the physician fee schedule, where I believe that means that physicians can prescribe healthy food to patients. And I was learning more about this. So he's all about these Medicare Advantage plans. So remember, Medicare, that's the healthcare for older people. And if you do an Advantage plan, that means that a company provides the healthcare plan, but the government pays for it. And he likes these Medicare Advantage plans because they do things like pay for gym memberships. But one of the things that Democrats don't like about Dr. Oz is that he is in favor of work requirements if you're receiving Medicaid. So basically, if you're not disabled and you are receiving government and taxpayer funded health insurance, then you should basically be looking for a job or have a job. And Democrats don't like this because they say that work requirements would mean that 18.5 million adults per year would likely lose Medicaid. But when I dug into this, their data is because they say that 70% of people who had to prove that they were looking for a job or had a job to get Medicaid, they were so confused about it that they weren't able to apply for it. So honestly, it's kind of this awkward situation that Democrats sometimes find themselves in, where they say these 18.5 million adults won't know how to apply for Medicaid, even though they need it. I don't know, maybe there's some truth to that. But he's also about changing the way that our healthcare data is used by private companies, which is interesting and controversial. He talks about it as the patient-centric healthcare ecosystem. They have this whole program, Make Health Tech Great Again. And one of the things he's looking at is how to create a data exchange where your medical data can be used by companies like Google to help you have personalized healthcare. So one of the things I just think is like the general theme of this is like, again, you have these Democrats dismayed that Dr. Oz is around, even though dude is clearly brilliant. I mean, being real about it. And he's clearly a successful business person, which I know irks some people because it's kind of this mixture of business and government. But honestly, only somebody who has made investments in like health tech companies would know that they should really prioritize how we share our medical data in a new way that sort of embraces technology. You know, make health tech great again. And just personally, sick care to wellness. The Food as Medicine Coalition, yes. And we gotta do something, because even though I know Democrats don't like Make America Healthy Again, which I find so ironic, given that just before the Trump era, 77% of them were about this stuff, there are a lot of people in the United States that want to see the healthcare industry change. And it seems like one of the biggest movers and shakers behind the scenes, it's Dr. Oz.